lovelies. Today I'm in the emergency room. Yep, this is the last thing I want in my life. But I'm in the emergency room because of my accident yesterday. And I'm continuing to have some symptoms. I'll keep you posted. Take care, bye. Hey, my lovelies. It turns out I do have a concussion. And I am not allowed to go to work for the next few days. And at this point I'm just waiting for an Uber. My head doesn't feel right. I'm so tired all the time. And I'm in so much pain. So with this, I'm just going to request one thing to you guys. Please drive carefully. Just because the roads are less crowded than it was before doesn't mean people have to drive like crazy. I wish you all the best. Stay safe. Bye. Today I'm at post-concussion. I'll show you how it looks. It does not look the same. My lovelies, I've been waiting here for so long. They just made the hallway just lying here. They said they need a neuro consult. I don't know when they will come. Hi there, my lovelies. I've been here since about 6 something a.m. and it's, I don't know what time it is. It's in the afternoon. It's like 1:30 p.m. I had a consult with the neurologist. Now I have to do a CT scan again. And I was told that a few hours ago, and I'm still waiting for the CT scan. I know how busy they are because of all the COVID patient coming. I'm just hoping to get that CT scan done soon so that I can go home. I'm hungry, I'm tired, I'm hurting. I can't even concentrate anymore. So I have volunteered in this hospital before, and I know how dedicated the staff and the doctors are, but at this point they're as overwhelmed as everybody else, any other hospitals. So I'm hoping to get the CT scan soon and leave. And once I'm done, please pray that I never have to come here again, any year again. Bye. Of course, they took somebody else for MRI. That means I have to wait a longer time. I just don't have the patience anymore. I had my breakfast at around 4 o'clock and it's over 2:15. The cafeteria is closed. I'm hungry. I just don't know what to do. Trust me, I have worked in the hospital for a decade. I understand the process, but today I'm quite irritable. I just don't have the mood. The concussion made me moody. When I'm gonna get the CT scan, I'm waiting outside the CT scan room. Once the CT scan is done, I have to wait even longer for the result, then get discharged. Cafeteria is closed. I'm hungry. I have to go home. You can imagine my mental status right now. So I'm gonna end by saying one thing. If you really do not go to the ER, if you really need in a life and other than life and death situation, If you're sick, go to the urgent care. Going to the urgent care will not only save you money, but time. My dear lovelies, just had the CT scan done. Took 5 minutes. I do 8 hours for a 5-minute CT scan. The technician was really nice. Now I'm told I do it at least half an hour for the result. That's life. Lovelies, I was told I'll be discharged soon, and it's already 2:50. So I've been here for how long? From 6 to over close to 9 hours. So during the 9 hours, all I had was a neuro consult for like 2 seconds, a 5-minute CT scan, and a whole lot of waiting. So as I said before, and they did the CT scan again, which shows the same results. So this is what I call low value care, so unnecessary treatment. They did the treatment. I wouldn't have come because I went to the ER before. Didn't want to come here again, but my doctor wanted me to come here again, and that means my insurance had to pay extra for a bigger emergency room, bigger hospital, and I had to do same CT scan again, which basically showed the same result. And now it is a double waste of money. If people stop doing that, these are called low value care. If people stop doing that, those unnecessary treatment, we could use that money for universal health. So again, I urge you, if you're sick, and this is in life or death situation, go to your doctor for urgent care, but not here. Hi my lovelies. Today you have heard about my experience. I went to the ER around 6 o'clock and didn't leave until 3:30, and during that 9.5 hours I probably had interaction with a medical student for 10 minutes, 5 to 10 minutes, a neurologist for 5 minutes, a nurse for like about 5 minutes, and my CT scan took about 5 minutes. Rest of the time was all waiting. It was a waiting game. I don't blame the healthcare providers. I saw the dedication in their eyes. I've seen it for a long time. As a I told you I worked in a hospital for about 10 years, more than 10 years. So I've seen that dedication. But what I saw today really upset me. Not for the healthcare provider, but I saw how overwhelmed they are. Usually in the nursing station, in the medical station, there's somebody. During that 9.5 hours I was in the hospital, I have not seen anybody sit down for a second. They were constantly running around. So this shows how overwhelmed the healthcare system is. And the pandemic didn't make it any easier. I don't blame the healthcare provider for my waiting, because they were doing their job. But I blame the system, which didn't take the appropriate action from the beginning. So please, as a respect to the healthcare providers, With respect to these frontline angels, when you are sick, first try to go to your doctor. And if it's a little more emergency, go to the urgent care. Please leave the emergency room or the hospital as a very, very last resort. I would not have gone today if it wasn't for my doctor who insisted. And next time I will make decision based on my feeling about my body, because today I've seen how much hardworking each of these healthcare providers are and how overwhelmed they are. So they deserve our help, our cooperation. And by cooperation, I mean we each do our part. We social distance, we wear masks. When we get sick, go to the healthcare provider first. If it's a little urgent, go to the urgent care. That's what they're for, your urgent needs. But please leave the emergency for life and death situation. That's the least we can do for these heroes. I wish you guys all the best. Please stay sorry, it's my concussion brain. Please stay safe and healthy. Take care of yourself. Bye.